Welcome to our Wellness Wednesday. For those of you who don't know me, I'm Dr. Jyoti Patel. I practice here in the Valley. And today we're talking about women's health. And I love this quote by Maya Angelou: when women take care of their health, they become their own best friend. So hopefully you're here today to learn a little bit about women's health, hormone management, and all the things that change as we age, including our metabolism, our risk for diseases, and our weight. So, my promise to you today is to empower you with knowledge about female hormones and menopause so that you can love this time in your life. So, just to get started, just in the chat, if you don't mind, most women don't know that hormone imbalances cause them to feel unwell. Have any of you experienced any of these symptoms? Typical ones might be hot flashes or night sweats. Feel free to let me know in the chat. Things like brain fog or insomnia. These are typical menopause symptoms that we've all heard about. But what about the weird ones? Are there any strange or weird menopausal symptoms that you have experienced that you later found out was menopause? For me, a lot of times it was dizziness, ringing in the ears. I don't know if you've ever felt like you're running into walls more or feeling off balance. That was definitely for me. Itching. I don't know if that's something you guys have experienced ever, but I've felt like there were some really strange symptoms that have popped up over the course of the last decade as I moved through my 40s and now into my 50s. I can tell you my 30s were pretty good. I felt pretty well balanced. And then as soon as 40s hit, things started to slow down. I started to notice some changes with my hair and my skin and my weight, especially around the middle. Maybe some of you can relate to that. And then as time went on and I moved into my 50s, I started looking back at my 40s and saying, gosh, life wasn't too bad. So I don't know if you can relate to that, but these are a myriad of symptoms, and there's over 100 different symptoms that can be attributed to changes in hormones. So take a look at this list. If you've experienced any of these symptoms, you're not alone. Did you know that 1.2 billion women worldwide are affected by menopause? We make up 51% of the population. And as more and more of us experience perimenopausal, menopausal, and postmenopausal symptoms, it's really important for us to have this conversation about hormones, don't you think? And I'm guessing that's why you showed up tonight. Menopausal women make up 2/3 of the cases of Alzheimer's disease. Now, we are also the majority, 65% of patients with dementia are women. So there's a clean correlate between estrogen and dementia and Alzheimer's and women's risk for certain diseases. Also, women who go through menopause, 1 in 2 of them over the age of 50 are at risk for osteoporosis. And from my last talk, maybe you remember, but the risk of dying after a fracture, a hip fracture, within the first year is 30%. So it's an important health topic when it comes to talking about hormones and our risk for chronic disease. Did you know that 1 in 5 menopausal women will die of a heart attack? And there are more heart attacks than there are breast cancers in menopausal women. So we focus on the wrong things. This cardiovascular risk, this risk for stroke is twofold. This risk for diabetes and high cholesterol and high blood pressure is increased due to menopause. How many of you listening tonight have realized that there's been a shift in your metabolic health, in your cholesterol, in your blood sugar, in your blood pressure, in your waistline, in your memory? And it's not your imagination. It's actually a real thing. Now, why didn't we hear about this before? Why aren't people talking about the risk that women have during menopause? It's because have traditionally been underrepresented in medical trials. There have been very few medical trials where women are included. Plus, a lot of the studies are done on men's physiology, and they're targeted to conditions that are predominantly affecting men. So, unfortunately, this is pervasive in the medical community. How many of you out there have felt like your doctor didn't have enough information about menopause or hormones, or refused to treat you with hormones, or refused to give you any options for it? It's because medical schools and residencies lack the training when it comes to menopause and proper treatment options. And this stems downstream from the medical model that was built around men's health. The other piece of information that I'm going to talk about tonight is that the studies that have been done on women's health, unfortunately, have misguided us. Poor study protocols and misrepresentation of data has skewed our knowledge and our belief system when it comes to menopause and hormone replacement therapy. One of the biggest examples of that is this large study by the NIH in the 1990s that was stopped in 2002 called the Women's Health Study. Maybe you heard this in the headlines. Estrogen causes breast cancer. And after that headline went out, complete shutdown of any support to the postmenopausal women for 20 years. Now, we have just revealed in the last few years that the data that we collected from the study was false, was misrepresented. And in fact, what was said about estrogen and hormone replacement therapy in women was not true. So unfortunately, 20 years of poor women's health before we realized that we were basing our strategies for treatment on the wrong information. So, what do you think menopause is? For those of you watching tonight, you feel free, this is a small group, feel free to chat in the group with me and chat in the box with me. What do you think menopause actually means? What does that mean when we say menopause? Maybe you're thinking of it as a disease, but it's actually just a natural progression of aging. So, for those of you who don't know what menopause is, it's really defined by this one exact moment in life. The day that your periods have stopped for a year is called menopause. The time before that is perimenopause, and the time after that is postmenopause. Now, on average, women go through that day of not having periods for a year at the age of 50, but hormone changes can start as early as your 30s. How many of you out there have recognized that maybe the shift in hormones started way before your period stopped? Yes, I can say I have. And perimenopausal symptoms can actually start a decade before this serendipitous day we call menopause. And symptoms of hot flashes, night sweats, brain fog, weight change, fatigue, all the things we described earlier can last over 10 years past that glorious day when your period stopped for a year. So it's so important that we have this conversation because it's important to understand that these symptoms can occur and they're all related to a change in your hormone state. So I want you to think back to when you were in your 20s or when you were in high school in your teen years. Again, those benefits of those hormones that are surging. We feel fit, we feel energetic, our brain's functioning well, our body looks great, our waistline's slim, we're sleeping like a log, we have tremendous sex drive, our bones are strong, our mood is good, our motility and our bowels feel good, our hair is thicker. These are all the benefits of hormone production. So, going back a step, let me just talk a little bit about where we've been with hormone replacement therapy and where we've been with menopause. Did you know that in the early 1900s, when women used to go to their doctors for perimenopausal or menopausal symptoms, they used to not understand why women had these changes and they used to call them hysterical. They thought it was a mental illness. A lot of the physicians thought it was a deficiency in something. So some of the early treatments for menopause was actually giving them crushed ovaries or giving them testicular juice or even taking their ovaries out or taking out their clitoris because they felt like somehow that was causing these menopausal symptoms. So we've come a long way in terms of understanding female physiology and hormone replacement. So no longer are we tied to those old paradigms of menopause and hormones. So for those of you watching, what do you think hormones are made up of? Do you think they're made up of sugar, cholesterol, animal proteins? Where do you think the hormones actually come from? And this is important, and I'll explain why. Because if you ever wanted to get tested for hormones, this is where we would need to know. Did you know that cholesterol is the precursor to all your hormones? Cholesterol makes your hormones. So when we demonize cholesterol and we try to get rid of it or we say it's bad for us, In fact, we might be sabotaging our hormonal health. Okay. Cholesterol gets converted to the mother hormone called pregnenolone, which then gets converted to DHEA, which gets converted to testosterone, which gets converted to estradiol. So when we do testing in the latter half of the presentation, I'm going to talk about hormone testing. These are some of the tests that your doctor may order for you. And just to let you know that this conversion of cholesterol into hormones is dependent on key vitamins and minerals. And later I'll talk a little bit about these key vitamins and minerals and how you can actually test for them. Because again, if you're suffering from hormonal imbalance, it might be upstream that you don't have the ingredients to make hormones. So now I want to talk a little bit about hormone cycles. So when you're in your 20s and 30s and everything's flowing beautifully, this is how hormones surge and fall throughout the month. I'm only showing you this screen so that you know that if you are still menstruating and you go to your doctor to get a blood test for hormones, it matters what day of the cycle you're on. Because if your doctor checks a random hormone level and you're cycling, you may not catch the right phase to understand what your hormones are doing. So for my menstruating patients, I typically will check estrogen here. This black mound is estrogen. I usually check it at day 14 if you're ovulating and if you're menstruating. And I will check progesterone around day 20 to day 22 because you can see this light green surge is progesterone. So if you're a menstruating female watching me tonight, just remember that the timing of your month matters because checking a random hormone panel is not going to get you the answers you're looking for. Now, if you're a woman in your 40s and you start to have changes, you're noticing your progesterone is starting to drop. That's the thing that drops first, by the way. You start to have hair loss, thinning hair, thinning skin, wrinkles, waistline starts to spread a bit. You start to feel tired. You're becoming a little bit more anxious and moody. All those are signs of low progesterone. And then as you migrate into your 50s, both estrogen and progesterone take a dip. And then for the latter half of your life, the progesterone estrogen levels are flatlined. This drop, this blue zone right here, is that post-perimenopausal phase where women have hot flashes, night sweats, brain fog, changes in libido, urinary changes, headaches, aging symptoms. This can spread out 10 years before and after this sort of line. So keep that in mind. It's all basically genetically driven or environmentally driven, how long you're stuck in this phase. So now the next question, a lot of my patients come and ask me, do I take hormones? Do I not take hormones? For those of you who are watching me tonight, feel free to chat in the box. Comment for me, do you think hormones are safe? Or do you think hormones are risky? And maybe even let me know why you think they're safe or why you think they're risky. It's a really controversial topic, and we're just starting to get to learn a lot about women's hormones. And I find this a really interesting and important to talk about. And a lot of people out there in social media are talking about it, celebrities are talking about it, Oprah's talking about it. So again, we see a lot of noise now going on about whether or not DNS is safe. Yes. So we're talking about the use of hormones and whether or not it's bad, good or bad. And Lynn says risky. See, there's definitely controversy in the world about whether it's safe or risky. And the answer lies somewhere in between. So here's a new shocking update. Estrogen, in fact, does not cause breast cancer. So the study, the Women's Health Initiative study that was done and shut down in 2002, looking at the data again, even the researchers in the study themselves have now admitted that what they put out into the public was incorrect. In fact, when they looked at women where estrogen was given alone, there was a 45% decrease in breast cancer mortality. And when women were given estrogen and progesterone, the effect was neutralized, meaning they didn't cause, raise, or drop the risk of breast cancer. So for those of you who are curious about this and want to learn more about the trials and the research that's going on in terms of safety, I recommend this book It's called Estrogen Matters by a medical oncologist, Dr. Avram Bluming, an excellent book. And looking at the new data and the new revisions of these particular women's trials, the Women's Health Initiative and the Finnish trial. Another shocking revelation about hormone replacement therapy. Estrogen does not cause heart disease, stroke, or blood clots. In these studies, and I've listed some of the studies here, the women's studies that have been now looked at, when women were given hormone replacement therapy early, and when I say early, I mean within 10 years of menopause being that magical day when your periods have shut down for a year. When women were given hormones early in their menopausal state, there was a 40% decrease of heart attacks and all-cause mortality compared to those who didn't take hormones. How interesting that we haven't been given this data. Not only that, but specific studies like the KEEPS and ELITE studies showed that when women were given hormones early and they measured the plaque buildup in their carotid arteries, there was actually a slower plaque buildup in women that were given hormones. And this other study, called the Finnish study, showed that women who took hormones had a lower heart disease risk by 54%, and the risk of heart disease went down the longer they took hormones. And hormone therapy has also been shown to reduce cholesterol and improve blood sugar balance. And I know this is important and shocking at the same time because it's not information that has been public, because it's not sexy to put stuff out like this or to retract statements from these big studies. This big study that I talk about, the Women's Health Initiative trial, was a $1 billion study funded by the government and the NIH. And it was the biggest blunder of the century. Now, if you are considering hormone replacement therapy, I'm recommending you work with a skilled medical professional because there's not one size fits all for everyone. And you do need to make sure that you have that conversation independently with your own doctor. Besides the two, there's a question by Felicia. Is there info on benign cysts from estrogen? So does it cause breast enlargement? Does estrogen therapy cause breast cysts? That's a really good question, Felicia. So what we know about that is the mode of delivery. If you take oral estrogen, that by far can cause more systemic side effects like breast tenderness and breast enlargement than if you deliver it in a patch or a cream transdermally. So now the recommendation is to consider the estrogen as a patch or a cream as opposed to an oral because it decreases the amounts of systemic side effects from the estrogen, like breast tenderness and breast enlargements or breast cysts. Besides the benefit to your heart and besides the benefit to breast cancer, lowering your breast cancer risk, estrogen and hormone replacement therapy helps with hot flashes, night sweats, osteoporosis, recurrent UTIs. How many of you have noticed, if you're going through hormonal changes, that your urinary habits have changed? Maybe you have a little bit more frequency. Maybe you have a little bit more sneezy coffee leakage. Maybe you have a few more recurrent urinary tract infections. These are all related to loss of estrogen, and we are not taught that. So in addition to that, hormone replacement therapy can help with painful sex and vaginal dryness. It can help with mood swings, low libido. It can help us with our belly fat, body composition, and energy. But did you know that hormone replacement therapy is one of the first line treatments for osteoporosis related fractures? Because by far, there's so much evidence that that perimenopausal state causes a shift in our bone growth. And replacing estrogen in that first decade of menopause prevents the further progression of bone loss. So bone health is a non-disputed benefit of hormone replacement therapy. Also, brain health. So women had a higher prevalence of Alzheimer's disease if they didn't take hormone replacement therapy. We're still looking at the nuance of how treating with estrogen helps the brain, but there's definitely a correlate between the brain changing peri and postmenopausal. There's a great neurobiologist that has a wonderful TED talk on how the brain changes before and after. Her name is Lisa Mosconi. So if you ever are curious about how the brain changes and how your risk for dementia can significantly increase postmenopausally, I invite you to to look at Lisa Mosconi's TED Talk. She's a neurobiologist that specifically looks at women's brains around menopause. So when do we recommend hormone therapy? We recommend it to, if you are going to consider it, started before the age of 60, or at least within 10 years of that magical day we call menopause, to, to get the benefits and outweigh the risks. Remember that if you have a uterus, you need both estrogen and progesterone. And if you have no uterus, you can get away with just doing the estrogen replacement therapy. One thing that's never talked about in women's health is testosterone, because it's off label. It's non-FDA approved for women. But remember what I said? We all make testosterone, estrogen, and progesterone, men and women. And so it's a very important part of our hormonal health. And so talking to your doctor you might be able to assess your testosterone needs as well. So now that question, and Tanya, you have a question. I'm on Depo-Provera because of bad endometriosis. Can I take HRT? I have a lot of perimenopausal symptoms, especially dryness. I'm 47, and that's where I would like to solve that problem. Yes, I would definitely talk to your doctor about when to test you, because what we believe about endometriosis is that it's an estrogen dominant disease, and Depo-Provera is progesterone. So do we give you estrogen? Do we not give you estrogen? When do we give you estrogen? So my recommendation is talk to your doctor about checking your estrogen mid-cycle. And if your level is anywhere from 100 to 200, you don't need to replace estrogen. When your estrogen levels start to drop down below 10 or 5, you might be a candidate for adding estrogen patch or topical vaginal cream or whatever you like to the Depo-Provera that you're currently taking. So that way you're still getting that progesterone balance, but you're adding estrogen as you need it, being that having endometriosis may mean that you already have too much estrogen going on in the system, and you may want to work on getting some of that estrogen down before you start replacing it. Now, remember that that's complex. Estrogen can come from the body. Estrogen comes from the food that you eat, like xenoestrogens, like plastic, BPA, pesticides. Estrogen can come from bad gut health. So if you have poor gut health, that bacteria can recycle estrogen into your body. So for folks that have estrogen dominant problems, another topic altogether, we really want to make sure that we're getting that estrogen balance before we start replacing estrogen. Hope that helps. So now replacing hormones can be tricky and nuanced. So it's really important to work with a skilled provider. Estrogen best delivered through the skin through a patch or creams like vaginal creams. There are estrogen rings that you can put up the vagina, and that can help replace the estrogen. And progesterone is best delivered in an oral capsule because it doesn't go through the skin very well. So if you have a uterus, you need both the progesterone and the estrogen. People always ask me about compounding. Yes, I do compounded hormone replacement therapy. They are beneficial. I've been able to help a lot of people with it. But to be honest, there are no studies on compounded hormones, so there's no outcomes data for me to present to you. People always ask me about bioidentical versus synthetic hormones. Now, most of you may not know the difference. Synthetic hormones like Premarin and Prempro are derived from the urine of a pregnant horse. So, pregnant mare. That's where the mare urine comes from, Premarin. And so, horses' urine does have different estrogens than humans do. So, sometimes people want to take something that looks like human estrogen or estradiol. So, they take bioidentical, an estradiol molecule that looks identical to human biology. Now, the next question I get is, can I get a bioidentical hormone from my pharmacy, or do I need to go to a compounding pharmacy? You can get it from your regular pharmacy. There are many pharmaceutical companies that are now making bioidentical estrogen and micronized bioidentical progesterone that you can get. It's inexpensive, it's through your insurance, and it's at the local pharmacy. You can get it as a patch for the estrogen and a pill for the micronized progesterone. Now, some people want designer hormones, they want it designed to their labs. That's when you would go to a compounding pharmacy. A lot of times patients will say, you know what, I don't have a doctor near me that can treat my hormone problems. Now there are apps, virtual clinics where you can meet with a skilled, qualified physician who is trained in menopause that can help you get your labs or get your prescription. And I've listed a few of these virtual clinics here. Feel free to write that down and research it for yourself if you're having trouble finding a good clinician that is skilled and willing to write for your prescription. Oftentimes, patients will call me because their regular doctor is not well versed or uncomfortable with prescribing hormone replacement therapy. And that is unfortunate. And hopefully, we will see a huge change in prescribing habits in the next few years. Now, there's also contraindications because remember, with any prescription drug, we do need to be careful and make sure that you are not at risk for having other problems from hormone replacement therapy. And I mentioned this, if you're 10 years out from menopause, that magical day where your period stopped for a year, we don't have data to show safety or benefits after that 10-year mark. So when women come to me and say, I haven't been on it ever, I'm in my 70s now, should I take it? I usually say, I don't have the data to tell you that it's safe or effective. Now, if you've been taking it since you were in menopause, let's say you started it in your 50s and now you're in your 70s, I say keep going. Okay, so because there's no data to show that you have to stop it at any time. Meaning, if you've already started it and you are benefiting from it and want to continue to take it into your 70s, 80s, or 90s for bone protection, for heart protection, for brain protection, I'm all in. Okay. But if you've missed the window and you wanted to start it late in life, I cannot tell you that I have the data to support the use. So that's a conversation with your doctor. Now, along with hormone replacement therapy, because hormone replacement therapy may not be for everyone. You may choose not to do it. You may still have doubts about whether it's right for you. You may have no physical reasons why you want to take it. But I am a big believer that women need to be empowered with taking back control of their health with nutrition, with sleep, with stress management, with exercise, with cleaning up their environment, and specifically supplements that can help us with that. Since being perimenopausal, I've now been diagnosed with high blood pressure. So I'm on blood pressure medications. I also take supplements like vitamin D, omega, magnesium, etc. You once said you shouldn't take D3 with BP meds, but you do need it for magnesium to work well. So when should I take it? I take magnesium at night along with my D3 and BP meds. So there's no contraindication with it. I would say, again, there's a time when medications are taken best and when supplements are taken best. Your blood pressure medication is best taken at night. So I'm happy to see that. Your vitamin D is best taken in the morning with a fatty meal because it's fat soluble. So to get the best bang for your buck, I would shift that vitamin D to the morning and I would add it to your breakfast. The magnesium can be taken at night. It's a wonderful relaxant. It helps us with sleep. It helps your bowels move the next day. So I'm okay with the magnesium being at night. Now, your question, I'm guessing, is, aside from the vitamins, if the blood pressure is a problem, really, in the next part of my talk, Tanya, I really emphasize getting your body into the best shape as possible. So if the blood pressure can be benefited from any kind of nutritional changes, exercise, sleep and stress management, weight loss, I am a strong believer that the body wants to be in balance. And if we can get you to that point where you don't need those blood pressure medications anymore, that would be ideal. But again, another conversation with your primary care to see if you're able to come off of your blood pressure medications. Yes, working out, weight has gone down. I love, love, love that. All right. So nutrition. It's a question that every woman who comes into my clinic mentions. What should I eat for menopause? Everything I eat seems to go right to my belly. I can't seem to lose weight and I'm frustrated. So my first task is to teach my women patients that quality matters. Just focusing on cutting out calories and being super calorie restricted is only going to cause more stress, more cortisol, cortisol is going to lead to more insulin resistance, which is then going to cause more belly fat. So putting yourself in a state of chronic deprivation actually causes more belly fat. I know you're like, why? Because I'm not eating, but it's because you're not eating that your belly fat's not going away. So instead of focusing on cutting out calories, let's talk about adding in nutrients. First, try to move to a whole food anti inflammatory diet. I want you to just take a minute and think about what you've eaten today. How much of what you've eaten comes straight from the garden or the farm? And how much of you've eaten comes from a factory and has been processed in any way? This could be packaged foods, cereals, yogurts, additives, things that are coming out of fast food restaurants. How much of the food did you chop up and cook yourself? And how much of the food came prepared for you? Now try to move the needle away from the prepared to you making it yourself as much as you can. Cutting out the refined sugars, the processed meats, the factory raised animal products, alcohol. I know I'm gonna get a lot of haters here, but alcohol is huge for women in terms of cancer risk, breast cancer risk, dementia, and belly fat. So there's nothing really healthy or beneficial about alcohol. So I just want to make sure that people are starting to think that way and moving away from alcohol and moving away from refined processed foods. Now, there's things that you want to optimize. You want to optimize your protein intake. And there's a little bit of confusion about how much protein one should have. And I've got something very simple, a gram per kilo or half your body weight. Some people say you need to do a whole gram per pound of your ideal body weight. For a lot of us, that is really tough. So I say anywhere from zero point 0.7 to a gram of your weight would be fine. Omega-3 fats, fatty fish, nuts and seeds. And the third component of your diet has to be fiber. All right. Fiber is going to help you burn fat. It's going to help you stay lean, keep you satiated. It's going to activate those GLP-1 receptors in your stomach, the Ozempic receptors that we make naturally. Protein, fat, and fiber stimulates appetite suppression, fullness, helps us with weight loss. So now here's something I want you to do. I want you to pull out your phone and download this free app called Chronometer. It's basically a food tracking app. And as an exercise, if you want to lose belly fat, I want you to do this one thing. For 1 week, I want you to try to get to 100% of your daily allowance of magnesium, zinc, B, D, K, fiber, omega-3 fats, and protein. If you can work on adding things to your diet instead of focusing on taking it away, you're going to be more successful in helping yourself with weight loss. So I encourage you to do that. Oh, yes. Tanya says all of her food is natural now. It works. Believe me, I am a believer. Definitely a believer. There's another question. What's the name of the app? Oh, I'm sorry, Lynn. Let me go back a step. It's here at the bottom of the screen. It's called Chronometer. Okay. So there's a free version and there's a paid version for the advanced stuff. But I just have the free one on my phone and it works beautifully. And I promise you, when I track my food, all the snacking goes away, all the processing goes away, all the added calories and all the nonsense goes away because again, awareness is power. So if you are keeping notes, add these foods to your shopping list. Okay. Try to put wild salmon in your shopping list. Try to eat it at least once a week. I usually do dinner and then I have it for lunch the next day. So I get 2 servings of wild salmon a week. And if I don't do that, I get smoked salmon and I have that for breakfast. Wild salmon, rich in omega-3 fats, vitamin D, and protein. Next, get yourself as many greens from the produce section as you can. Kale, spinach, chard, collards, romaine, whatever you want. And cruciferous vegetables like broccoli, cauliflower, cabbage, kale. All these vegetables not only have high amounts of fiber, but they're rich in calcium, vitamin K, and magnesium. Remember, I told you there are hormone balancing minerals and vitamins? I'm going through them now. Fermented food like sauerkraut, my favorite, is rich in probiotics that helps you with your gut health and rich in vitamin D3 and calcium. Citrus fruit, You can do any fruit, berries, kiwis, oranges, lemons, limes, apples, I don't care. Anything rich in vitamin C is going to help you with your hormonal health. I mentioned omega 3s with nuts and seeds. You found some good wild salmon at Sam's. It's all individually packed and takes 15 minutes in the oven. Who else out there loves their air fryer? I mean, that has been a game changer in my home. I'm going to tell you, it's a game changer. I take that salmon, I dress it with some seasoning, I put it in the air fryer, 8 minutes, completely cooked, beautiful, flaky, and tastes amazing. So I'm a big fan of an air fryer. Oven's great too, but I love that you're recommending that. Has anybody else found any great tips for things that you're seeing here on the shopping list that you want to share with the group? Feel free to use the chat because we're learning along the way. Fiber, beans, and legumes. So whether you soak your beans and have it the next day, you get a carton of beans and you do it that way, you throw it in your salad, you're buying some quinoa, some brown rice. That's rich in fiber and B vitamins. Remember, that's one of the things you're going to need to make good hormones. And lastly, antioxidants that decreases the aging process comes from spices and teas. Also decreases inflammation. So add in that green tea, that turmeric, that ginger, all of that stuff is good. Don't forget your water. A lot of my women dehydrate throughout the day. That causes brain fog, that causes fatigue, that causes hunger, that leads us to making bad decisions, especially around 3, 4 o'clock in the afternoon. I don't know if you felt the slump, but a lot of times if you just increase your water intake, you will be able to make your way through that evening hour. The next place is if you wake up with a dry mouth in the morning. Oh, yeah, Deanna. Chia seed pudding, whether it's mango or banana, my favorites, rich in omega 3 fats and fiber. Love, love, love. So if you have dry mouth in the morning, you want to make sure that you're drinking enough water through the day. Here's another tip. Food is medicine. So if you're suffering from hot flashes, but you're not ready to take hormone replacement therapy and you're trying to find a natural alternative, I posted this in a video, but they did a study called the WAVES trial. And women who ate a cup of soybean every day, they actually had a reduction in moderate to severe hot flashes by 54%. All right. So soy gets a bad rap. How many of you out there in the chat can tell me soy is bad for me? I've heard soy is bad. Again, another myth debunked. Whole organic soy is a rich source of minerals, vitamins, fiber. It's so good for perimenopause. Remember that the largest consumers of soy are Japanese women. All right. And Japanese women have the lowest rates of breast cancer. Do you know who has the highest rates of breast cancer? Western women. All right. So if we were consuming a lot of soy, I would say, okay, there's something there. We actually don't consume a ton of soy, but the women in Japan actually do, and they have the lowest rates of breast cancer. So that speaks of volumes about how soy is not the culprit. Do you know what is? Processing and GMO and things that are sprayed in our fields like glyphosate. So hot flashes, these are some of the phyto-rich foods I put here. If you're worried about wrinkles and you want more collagen, you want to increase your zinc intake. If you're having a lot of trouble with stress, consider that magnesium-rich dark chocolate at the end of the day. For heart health, for brain health, for bone health, vitamin D, rich in these foods. If you're worried about your bones, you have osteoporosis or osteopenia, remember vitamin K2, M7, super important for bone health, not just vitamin D, K2. Let me explain. Your bones are made up of collagen, protein, and calcium, and some trace minerals. When you eat foods that are rich in calcium, like dark leafy greens, vitamin D helps your body pull that calcium into the bloodstream. Think of it as you went to the movies and somebody took your ticket and let you in. That's vitamin D. Now that calcium is loitering in the hallway, right? That calcium is in the bloodstream. Vitamin K2 takes the calcium and deposits it into the bone. So it's like that usher that takes you to your seat. Right? So you need vitamin D to absorb the calcium, and you need vitamin K2 to move that calcium out of your blood vessels into your bones. So that's important. B vitamins, helping brain health. I mentioned this already. Again, really good foods for that are listed here. Oops, did I skip a step? Oh, yes. Now, it goes without saying that your hormone balance relies on your gut microbiome. Your gut microbiome are trillions of bacteria that live in your colon that regulate your hormonal balance. We mentioned it earlier when Tanya talked about endometriosis. And so this is part and parcel of what I recommend as part of my formula is to fix the gut with fermented food and fiber. I get a lot of questions about intermittent fasting. Studies do show that it can help with diabetes, insulin resistance, belly fat, breast cancer risk, and hormones. But with women, it's nuanced. If you're stressed, don't fast. It makes things worse. If you're not stressed, then fasting may help you lose a little bit around the waistline, help you with fatty liver, help you with prediabetes or diabetes. So it does help with some of those metabolic functions. Now, most women will skip breakfast. I challenge you to do the opposite. Eat breakfast, skip dinner. There are some really good studies to show that our hormones are circadian and we peak in the first half of the day and we drop our insulin and cortisol at the latter half of the day. So it's better to eat your biggest meal at breakfast and skip dinner or eat your lightest meal at dinner. Deanna has a question. Tofu soy then would be better option instead of meats or balance of both. I'm a flexitarian. I eat everything. I just do it in moderation. So if you find that you're more satiated with chicken or poultry or eggs or pork or beef, and you're getting good quality, pasture raised, grass fed, grass finished, no hormones, no antibiotic meat, then it might be the right balance for you. But if you're finding that you want to do a more plant based, plant forward vegetarian diet, maybe consider adding a meatless Monday where you have tofu stir fry, or you would make a Thai curry with tofu. Or I have a really great recipe where I use tempeh, which is a fermented tofu, and make it into a bolognese like your meat spaghetti meat sauce, but instead I use tempeh and it tastes just the same. So you can make the substitutions and see where you can add in a few more beans, legumes, and soy products that are whole and organic. And then there's some teas that can help with hormonal balance, that can help us with mood and agitation and hot flashes. And I've put some of these here. So ultimately, our goal is to add in those good fats, add in those key minerals and vitamins, and cut out all the bad fats, oily foods, fried foods, sugar foods, baked foods that are going to add in chemicals, dyes, preservatives, and xenoestrogens. Xenoestrogens are chemicals in our environment that look like estrogen and they cause disruption, causing a lot of symptoms and dysregulation. So our goals are to reduce our visceral fat. This will help us with our insulin resistance and our food cravings, removing alcohol, as I mentioned before, tobacco because it's increased risk of cancers. I'm just mentioned changing out some of your skincare products. This is another tool I want you to have. It's free. Go to this website, ewg.org. They have a platform called Skin Deep. And in that platform, they list all the skincare products, all the makeup products, all the household products that we make in the States. And they give it a ranking as to how toxic that product is. Not only that, but this website will give you alternatives so you can buy clean skincare, clean makeup, clean household products. So start changing things in your home. Get rid of plastic from your kitchen. Get rid of Teflon from your kitchen. Known estrogen doppelgangers, known hormone disruptors. Replace it with glass and replace it with ceramic and stainless steel. Start to remove things that are wrapped in plastic that you cook in your microwave. Get rid of those plastic cutting boards, right? All these things in your house that's adding microplastics into your body is causing havoc, inflammation, and disease. All right. So it's so important to start cleaning your own home environment, your own bathroom environment, and your own closet and your skincare environment. It goes without saying that I'm a big fan of adding exercise to your protocol. And strength training by far is my number one recommendation for you. It doesn't matter how old you are. I want you to think about adding 3 days a week, 10 minutes of lifting. You can start low, go slow, and then incrementally increase the amount that you lift to help you build muscle and bone. With this, make sure you're doing a little bit of yoga or balancing or going for a walk. It's getting your cardio and your steps in and taking some time to go outdoors if it's not 120 like it is here in Arizona. You replace everything to glass and stainless steel. Awesome. Such a big change in your physical state. I just posted a video where the New England Journal of Medicine found that when they did dissection of the carotid arteries of 300 people, the plaque in their arteries, they found that there were nanoparticles, microplastics embedded in the plaque. Mm. And the people that had microplastics embedded in the plaque of their arteries were 4 times more likely to die of a heart attack, stroke, or any cause in the following 3 years. So it tells us that these microplastics are slowly killing us on the inside. So it's an important part of your health and wellness. Strength training, super important. But you know what's even more important for weight loss? It's your daily activity. It's called non-exercise activity time. So how many of you, and you can let me know in the chat, wear some type of fit tracker, whether it's counting your steps or your activity levels? How many of you? And if you don't, I strongly encourage this one thing because it is going to change your life. All right. What we have realized that we're not, what kind of pots and pans? There are green pans, ceramic pans. I'll put in the chat in a second brand that's super clean. So you want to make sure that you're moving your body all the time. It's not about us aging. It's about us getting more sedentary. All right. People are doing it. Awesome. And I want you to just take a second, and you don't have to if you don't want to, but tell me how many steps you took so far, right? We're hitting 6 o'clock. How many steps? How many steps have you taken today? How many miles have you walked? Awesome. Awesome. I love these guys. Most people in the United States are under 4,000 steps a day. All right. I love this crowd. I love this crowd. So 11,000, 9,000, 7,900. Oh my God, you guys are rock stars. Studies show that if you are going to the gym for 30 minutes and exercising, but you are sedentary the rest of the day, you're still at increased risk of dying of a heart attack, stroke, and diseases of all kind. Okay. So sitting is the new smoking. We know that it's not just being active that's important, but not sitting as much is just as important. All right. So try to up your game. Get up every hour, walk around, take some stairs, park further away, track your steps, see how many steps you're getting. You're hitting the end of the day, you didn't get over 7,000 steps, get out there and get some steps in because you want to improve your longevity by doing this. And awareness is the path to health. If you're not even aware of how many steps you took today, how do you know where you're going to go tomorrow? Right? And you're not competing against anyone else. You're only competing against yourself yesterday. So if you can just take that one thing away and increasing your steps every day, you are going to do loads of good for yourself. Another one is sleep. How many of you have trouble sleeping? Me. So if your sleep problems are related to hot flashes or night sweats and you don't want to do hormone replacement therapy, that's fine. But really start to work on cooling the body down at night, dropping the temperature in your home, right? Drink cold water in the evenings, wear light clothing, take a cold shower. Dropping your body temperature by 1 degree has been shown to help improve sleep. Make sure you're wearing light clothing or a light sheet. You're not inundated with a lot of noise and light. Make your environment comfortable. Don't bring your technology to bed. Yes, I'll say it again. Don't bring your phone to bed. Put your phone away into the other room or at arm's reach so that you're not tempted. Learn how to do things like meditation, breath work, body scans, journaling, gratitude. Things like that can help you not only sleep better, but it also lowers cortisol levels, which will help with belly fat, weight gain, blood sugar, insulin regulation, and slow down the aging process. So I'm a big fan of teaching people that too. Great. Here's some cotton sleepwear. Yeah, it has to be sleeveless. I know. Oh, you're in Jamaica. Okay. And you're living in Jamaica. It's pretty hot. Yeah. I live in Arizona. I get it. It's pretty hot outside. So keeping your body cool is super, super important. I have listed here what vitamins and minerals are important for testosterone, estrogen, and progesterone production. If you are not sure that you're getting enough nutrients, then I do recommend a blood test to see what your nutritional status looks like. And I'll talk about that in just a second longer. If you are interested in getting these supplements or look for vetted supplements, again, in my store, I do have a section where I've curated the best vitamins for women's health. You're welcome to look at that and see if you want to get any of those to help you with your supplement load. But remember, you can't supplement away a bad lifestyle. So make sure you start there first. I've curated a few things here for you guys. If you are having any specific menopausal symptoms and you are thinking, what are some of the supplements I recommend for things that you might be struggling with? I've made a list here. So feel free to jot things down. I do like to use adaptogens. For those of you who don't know what adaptogens are, they are plants that can sense how much stress your body is under and give you exactly what you need. It's kind of like an emotional support animal. If you're feeling anxious, adaptogens will calm you down. If you're feeling sluggish, then adaptogens will make you more energetic. They're interesting plants. They actually will sense the balance and give you exactly what you need. Isn't that fascinating? Have you guys heard of adaptogens? Anybody heard of adaptogens? Some of them are listed here. Ashwagandha, reishi, rhodiola, shatavari, maca. These are all considered adaptogenic plants. They adapt to the environment. So when you eat these plants, if the environment's stressed, they will calm you down. And if you eat these plants and you are sluggish, they will give you more energy. So I find plant medicine is fascinating. All right. So if you're going to go see your primary care doctor and you're like, what kinds of tests should I get? These are the tests that I typically recommend for my women. Get a complete blood count, a metabolic panel, get your cholesterol checked, not just the basics, the advanced panel. Make sure you're not diabetic or pre-diabetic. Check your A1C and your insulin levels. Look for inflammation in the body. That's the HSCRP. Do a micronutrient panel. Look to see what nutritional deficiencies you have. Maybe check your thyroid panel and also your hormone panel. If you're menopausal, you can check it at any time. But if you're menstruating, you want to make sure you're checking it at the right times. If somebody says they have gut issues or they're worried about their gut balance, I do a stool analysis. And if someone's curious if they've consumed a lot of microplastics, BPA, glyphosate, environmental toxins, sometimes I'll even order a tox panel. So if you're here and you've stayed with me till the end, remember, I want to help you. And if you have some of these questions, if you work with me in my mastermind program, you might get some of the answers you're looking for. First is, am I in menopause? What are my hormone levels like? Are my symptoms related to nutritional deficiencies? Am I at risk for some of these other things that happen during menopause, like heart disease, dementia, diabetes? Well, in this mastermind, you have these tests included. You get your nutritional panel with your vitamins, minerals, amino acids, and fatty acids. You get a full hormone panel. You get a full thyroid panel, but you also get the blood counts, the advanced lipid panels, the insulin, the diabetes testing, and the inflammation markers. In addition to that, you'll get a video from me interpreting the test results and the supplements I recommend on my free PDF guides on menopause. And you also get a 1 hour Zoom call with me, which is a group Zoom call for question and answers. So, it's not for everyone, but for those of people who are looking to kickstart a new lifestyle using data and biohacking, the best way to sign up for this program is to go to my website, which is my name, jyotipatelmd.com. If you go to the labs tab under programs, you'll see this hormone mastermind. This is the cost of the program. Typically, if you tried to buy these tests and consults individually, it would cost a lot more. So as a group, I'm able to offer this. And if this is not for you, you want to work one-on-one with me because you want to be a little bit more individualized, you are more than welcome to set up a free discovery call with me to see how we can work together. And you can either call our office line or reach me on the website. So as we all continue to age through time, it's our duty to nourish our mind and our body with the best ingredients of life for health, vitality, and longevity. My job here tonight was to bring mindful awareness to your choices when it comes to nutrition, movement, sleep, connection, stress management, paired with the best modern medicine has to offer. Thank you so much for coming and thank you for your attention to the end. I put in here a few of the references when it comes to hormones and hormone replacement therapy. If you have some downtime and you do want to do some light reading, I've added that to the presentation.